Good evening. I'm Mike Fortune, and I will be your host for this, our weekly town hall meeting concerning the COVID-19 outbreak here in the city of Hamilton. We welcome everyone watching and listening on Cable 14, 900 CHML radio, and on the City of Hamilton YouTube channel. Once again, this evening, we are broadcasting live from the council chambers down here at Hamilton City Hall. And before we start, it is very important for you to know that we are following all recommended procedures, including physical distancing for tonight's broadcast. In order to promote physical distancing, this town hall is entirely virtual. Only essential personnel are here in council chambers. In-person attendance is not available for residents or the media. And tonight we will continue to share the latest information and answer many of the questions you have regarding the current status of the COVID-19 outbreak within our community. We have a panel assembled that will spend the next hour answering your questions. Joining me once again this week here in council chambers are Mayor Fred Eisenberger, Mr. Paul Johnson, Director, City of Hamilton's Emergency Operations Center, Dr. Elizabeth Richardson, City of Hamilton's Medical Officer of Health, and lastly, joining us this week, Chief Eric Gert from the Hamilton Police Service. Of course, we welcome your participation in tonight's town hall meeting, and you can submit questions in one of two ways. You can go to the city's website at www.hamilton.ca/askcovidquestions, or you can reach us on Twitter by tagging @City of Hamilton in your tweet. As this health emergency continues, the city continues to receive numerous questions. And once again this evening, our staff are monitoring social media and, of course, the website. And we will get to as many of your questions as time allows. But before we start with tonight's questions, Mr. Mayor, would you like to begin with a current status within our city?
Sure. Thank you very much, Mike, and thank you to Cable 14 and CHML. I'd like to acknowledge our interpreter right off the top here, Rosalie Vizers and Georgia Whalen, who are doing a terrific job each and every time that we come out to translate for us. And I do also want to acknowledge that we understand and appreciate that not everybody in our community gets Cable 14, and not everybody listens to CHML. So we're looking at ways in terms of how we can get better reach, especially in the more rural communities, in terms of getting information out there. So we are doing our best to share information in every way possible, but we're well aware that there are some parts of our community that just aren't being reached, and we're going to do our best to see if we can make sure that we get to that point. Let me also start by wishing our Jewish community a very happy beginning of Passover. And of course, we would ask that, and then I'm sure they will, ensure that a safe and healthy Passover by celebrating separately in your own homes. That's the safe way to do it. That certainly applies to Easter and Ramadan a little later on. And I know it's a difficult time. Our tendency is to want to come together. But unfortunately, to do the right thing and to maintain that physical separation, we need to do it apart this year so we can do it in full celebration next year. Hamiltonians are doing their part to flatten the curve, and I'm very proud of the response of the community at large. And everyone's following, not everyone, but almost everyone's following the recommendations of our public health. Stay home, don't gather in public groups, only go out for essentials, one at a time if you can. And helping to stop the spread of COVID-19 is everyone's responsibility, and I know the majority of our citizens are doing their part. It's not a time to let up, though, so there's no relaxing here. I think there's an expectation that there is more challenges to come, and we need to do everything humanly possible to ensure that we maintain this physical distancing whenever and however we can. A reminder that our city parking lots, play structures, playing fields, field houses, park benches, and other park amenities are closed. Golf courses are also closed, and I know that Paul will explain a little bit more about the rationale behind that. Residents can use green spaces in parks in their neighborhoods, however, to get some fresh air. Please stay 2 meters or 6 feet apart, as a minimum 2 meters and 6 feet apart. But people need to get out, so walk in your neighborhood, but don't drive from the West Mountain and come down to the waterfront. The parking lots are closed. Don't park on the streets. Stay in your neighborhood. Virtually every neighborhood has some sort of green space, open space, and certainly lots of sidewalk and roadway. Use that for your outing and getting exercise and fresh air, and be courteous to others. And I see when I'm out walking that people are making great pains of separating themselves. In fact, when you come one-on-one, one person crosses the street and the other one keeps going, and vice versa. So there's a lot of niceties happening in our community that I truly appreciate. I've also asked the churches in the city of Hamilton to ring their bells each Wednesday and Sunday at 6 p.m. in support of our frontline workers, healthcare workers, first responders, everyone keeping our city cared for, safe and fed during this pandemic. And I did hear the bells going off this evening at 6 o'clock, and it was actually quite a nice treat. And I'm sure that will spread in our community, all to recognize the great work that our frontline people are doing in our community. So great work on all of their parts. And, the update is keep doing what you're doing, folks. I think most people are doing a terrific job. It's tough, it's frustrating, it's hard. We're all a little worried, but we understand why we're doing this. It's to prevent the spread, prevent transmitting that coronavirus to other people, and saving lives. And I think that's a laudable and a very important goal for our community. And so on that note, Mike, I'll turn it back to you. And I know there are lots of other questions we want to get to.
Great. Thank you very much, Mayor Eisenberger. We will move on to those questions, and we will start with Dr. Richardson. Let's start with a general update about COVID-19 cases right here in our city. And can you tell us about the current situation where we're standing tonight?
Thanks, Mike. Absolutely. Going to go through some numbers for everybody. So as of today, as of noon today, we have 198 cases. That's 15 more cases than yesterday. Those are confirmed cases here in Hamilton. Of course, there's a lot more details on our website if you're wanting to look up those things, but just a few highlights from it. First of all, again, we have 77 of those 198 cases have already resolved, and so those individuals have recovered. That's the good news, as you hear me talk about often, that for most of this is like a bad cold, and people go on to get better. And I think we really need to think about what those cases and their close contacts are doing for all of us, because these people, we're all staying at home and we're maybe going for those walks that the mayor talked about. But for those people who are sick, they are staying home. They're staying in self-isolation, away from their family members, away from everybody else, in order to protect the rest of us. And I think we have to remember to thank them as well, because it's so important, the things that they are doing to help keep this community safe. And if you think about a contact who may get sick after having 7 days of isolation because they're a contact, and then have 14 more days of isolation because they got sick, that's a heck of a long time to be staying home, to not be in contact with others. And so for the people that are doing that, we really owe them a debt of thanks for doing these things, because they're doing it for all of us. So our thanks to all of them. We have had a total now of 6 deaths. So you'll see up on our website there are 5 deaths as of noon. However, this afternoon, another death did come in. We're still investigating, and so not sure of all the details on it. But that will be back up on our website by tomorrow in terms of that additional death. In terms of where is it coming from in terms of the cases we have, well, by far the majority in the last week or so are from contacts of other cases. And then the second most common thing is the community-acquired cases. So those are both the highest numbers in this last week or so. We still have 4 institutional outbreaks that are ongoing. They're at Heritage Green Nursing Home, where there are 11 confirmed resident cases and 3 confirmed staff cases. Sorry. At Cardinal Retirement Residence, we have 16 confirmed residents and 5 confirmed staff. At Wentworth Lodge, it's still just the 1 staff member who's confirmed. At St. Joseph's Healthcare in Hamilton, you'll remember that the special care nursery had an outbreak when 3 healthcare providers tested positive on that unit. Good news as of today, that all contact tracing is now complete in looking at which babies had direct contact with those workers who had tested positive. And there were 5 babies in total that were contacts. All of those have been tested, and all of them have come back negative. So very good news for those babies and those families. And we'll continue to closely monitor that situation with our partners at St. Joseph's.
Doctor, thank you very much. We'll now move on to Paul Johnson. Paul, can you give us, please, a general update about the recent work of the city's Emergency Operations Center and maybe some key updates since we sat around this horseshoe last week?
Sure. So I think since we were here a week ago, certainly internally, it's been settling into the fact that this is going to be business as usual for a little while in the city. We are going to be closed in terms of public access to facilities and our business offices until late May. And so a lot of our staff are getting into that groove and figuring out how to support the efforts of the city along the way. And I'm sure the mayor will share that, one of the things that our staff and our councillors worked together on was how we could have city council meetings. And so that happened today. We're also supporting people to work at home. We know this is going to happen for a longer period of time, and we still are sending people home. If you don't have to be in an office, we're making sure people are home. The second thing we're starting to realize is, there are impacts in the community where we have to step in and help stabilize organizations that are having challenges with staffing and challenges in continuing to deliver their service. And one of those happened over this past weekend where the EOC, in conjunction with our healthcare partners and public health, had to work hard to stabilize a retirement home that was going through some challenges, not only with the residents who were in the home, some of whom were quite sick, but also the fact that they had got to critical levels in staffing and in provisions of PPE. So the city stepped in certain ways, the hospital stepped in great ways, and we worked in partnership over about a 36-hour period to stabilize those. And that's going to be a theme moving through this next few weeks. There aren't a lot of staff just sitting around waiting for things to do. It's particularly in healthcare, everybody is strapped and working very hard. And staffing levels are hitting some critical points in certain areas. Either people are isolating, or they're sick themselves, or there have been work refusals. And that can quickly put an organization at risk. And so I was really pleased to see us work together as a community to figure that out. The other piece we've been doing is a lot of planning work, and we're starting to execute on some further elements for our most vulnerable residents, those who are homeless in this city. And I know that some of this is concerning to the public. We see homeless individuals outside a little bit more, especially now that the weather gets better. I'd put this thought in people's minds. If you're without a home and out a place to shelter or stay away, and like the rest of us are, and your only option was to go into a fairly crowded space with a bunch of other people and share washrooms and share eating areas, would you do it? And that, for many in our community, is unfortunately the only situation they have. So we've been trying to figure out ways to keep them safe, to keep the workers in shelters safe, and provide additional services. I'm pleased to say we placed some portable washrooms and hygiene stations at a downtown location. They're at York and Bay. We've been working with drop-in organizations to extend their hours and their days of operation, and they are doing a lot of work to help support individuals experiencing homelessness during the day and providing tons of food. And I have to say a great deal of thanks to the organizations themselves, to Food Share that's helping out, obviously, is a great organization in this city, but also some nonprofit, charitable, and private sector folks that have stepped forward and are serving meals and helping people out, which is great. But we've really had to address in this last week what we're going to do in our shelter system, because we know this is going to continue on for some time. And so we have worked with a number of shelters for women, for men, for families, and have found ways to support those individuals in better ways. I can say that today we are working towards opening what we're calling a surge shelter, or an additional capacity shelter at First Ontario Centre. It will be a 50-bed shelter, which will do two things. One is provide us an opportunity to have more spaces available for individuals experiencing homelessness. But more importantly, it's going to help our 3 men's shelters to actually lower their numbers within their shelters currently. They recognize that their setup does not allow for the kinds of physical distancing that will help stop the spread of this, and they are very susceptible to outbreaks because of the numbers of people there. So their numbers will decrease. This additional shelter will allow for some overflow. And that is in addition to hundreds of hotel rooms that we have available. In fact, we have 46 people in hotel rooms in the city for various reasons. We have an isolation shelter for anybody who is COVID positive. Thankfully, that is only one individual who has been in the shelter system to date. And so all of these measures are trying our very best to figure out how to ensure that we have the best chance of stopping the spread of COVID-19 among homeless populations. I just want to reflect at the end of those opening comments to say that I think for me, when we come out of this, I'll have to think long and hard about these congregate settings we have in the light of a pandemic. You know, we have about 400 people in shelters on any given night. We have about 750 people who call residential care facilities their home. We have nearly 4,000 long-term care beds and a few thousand more retirement home beds in our community, all in some form of a congregate setting. And we need to, I think about that long term. And when some people say, why couldn't we just put everybody in their own home? The reality is, in the shelters and the RCFs, we simply don't have that many single rooms to do that and the staffing to support it. So we are trying our very best to do the distancing. We're trying our very best to keep everybody safe. And my final thanks in all of this is to our tremendous partnership with the organizations that deliver the shelters. And in this past week, Mike, because of the work we've done on the men's side, I do want to say a big word of thanks to the Good Shepherd Centers, to Salvation Army, and to Mission Services, who have worked with us tirelessly to figure out the best solution, supported by groups like the Shelter Health Network that continue to provide great health services to our homeless population.
Paul, thank you very much. Chief Gert, heading over to you now. A question has come in. Can you please talk a little bit about how the COVID-19 pandemic has impacted the Hamilton police operations?
Thanks, Mike. And certainly, I just want to do a little precursor here in terms of our incident management system, which we employ at the city. And you can see in this case, unlike many emergencies where they're fire, police related, this is public health related. We do have a format to interrelate, work with the partners, and Paul Johnson just mentioned many of them that we work with on a regular basis. So we are working as a team, physically distanced, to actually work in concert, and we have prepared for this. We did a lot of preparation on the pandemic back with the H1N1. So, for example, our service already had a pandemic plan in terms of implications of what could happen, decreases in staffing, all those kind of contingencies. And I think we're all learning in this case. Our role is really around how do we facilitate public safety? And in this case, the public safety is a public health emergency. So we're really relying on public health as a lead for best recommendations. I think what you've seen, and certainly what we've seen as a police service, is the legislation has changed and continues to change almost on a weekly basis. It then becomes our role to interpret that legislation and apply it, and do it within, obviously, constitutional rules and all the usual formats that we do, and we've been doing that. So obviously, we take a graded approach to enforcement. We would like compliance first through education. We will, in fact, liaise and interact with people and let them know. In terms of messaging, if you do happen to be at home, which many people are, the messaging is consistent all the way from the federal level to the provincial level to the municipal level. And key among those is physical distance and PPE where required, or personal protection equipment. So our priority as a service is to ensure that our members use that equipment to stay safe. They do continue to interact just as they always have, whether they're mental health calls, whether they are domestic violence, assaults, break and enters, really the full gamut of the responses that we provide already, traffic accidents. Yes, there are some decreases in terms of volume of people who are out there, but some of the legislation has changed. So we'll continue to do that, but the priority is not enforcement for its own sake. The priority is enforcement to ensure compliance, really for the safety of everybody. And we know, and not to over-dramatize it, certainly a number of politicians have stated, this is a life and death issue because of the nature of the illness and what can happen. So we don't want to over-dramatize, but at the same time, we don't want to under-dramatize it. So we want to stop the spread of COVID-19. Really, that's our role. Our role as a police service is to keep our members fit and safe, and we continue to do that. I'm quite impressed both with the members and their contributions, and they continue to do the calls for service. We've had some adjustments to how we do business, but for the most part, our members are responding and keeping their own safety and the safety of the public in mind.
Chief Gert, thank you very much for that update. We'll be getting back to you with some more questions. Back to you, Mr. Mayor. You spoke a little bit about today's virtual city council meeting. Can you touch on it a little bit more in regards to the meeting and particularly the tax relief that residents can expect, please?
Sure can, Mike, and but before I do that, let me just compliment the police service for continuing to keep our community safe and do the enforcement. You know, these folks have to go out and interact with the community at large, something we're asking all other people in our community not to do. They still are required to do, and they're stepping up and doing it effectively, efficiently, and carefully, and I really do appreciate and want to do a shout out to our police service out there doing a terrific job. So we had our first virtual council meeting this morning. It was an interesting journey. First time that we've everyone sat in their homes aside from myself. I was in the spot that you're in now, through Zoom and live webcast as well, so that the public at large could watch in. I have no idea what it looked like, in the live stream. But I hope it accomplished the task, which is what gets some of the important business of the city done, and demonstrate to the community at large that we can function this way, and we'll continue to do so as long as we have to. But that day, or today, we did pass and approve a 60-day waiver of penalties and interest for the next tax installment, which is due on April the 30th. Which basically gives those that are having difficulty managing their financial affairs right now virtually 2 months to come up with a way of paying their tax bill, and they can set it aside for a couple of months. We're asking people that can pay, of course, to pay. I mean, one of the challenges municipalities has is we don't have the deep pockets of the federal provincial government. We need tax resources year to year to maintain all the services that we have out there: police, fire, paramedics, keeping our city functional, repairing everything that needs to be repaired. So we cannot forgive taxes, but we in our way can actually defer to help people for the next 2-month period. And then we've also allowed for a 30-day period in the next tax installment, which is in June. So for all intents and purposes, people can set aside, if they have to, their next 3 tax installments until such time as this issue passes and everybody gets back on their feet, or some of the resources from our federal government comes into play. I'm hoping that'll be somewhat helpful, and we do anticipate and expect that more resources are coming from our federal and provincial partners, and we'll talk a little bit about that later. But it is a help, but we also authorized our MLE, Municipal Law Enforcement Bylaw officers, to allow them to fine people $500 if they're not maintaining physical distancing. So it is a bit of a draconian measure, but it's an important one because we know that if you're not maintaining that physical separation and you do infect someone, that is a very serious problem, and that then leads to potential spread. And so even though the vast majority of the population is doing exactly what we're asking them to do, we're asking everyone when they're in the store or waiting in line to get into the store, or if they're queued up anywhere, or walking through the park, that they maintain at a minimum 6 feet 2 meters. When we hear of groups getting together in the park for a pickup game of basketball or a pickup game of soccer, that is a no-go, and that'll certainly trigger some complaints, and that'll trigger a visit from a bylaw officer. Their first inclination is to warn people and educate them as to why this should not be happening. But if people fail to listen to that, then those tickets will be handed out, and we'll expect them to pay. And it's punitive, and punitive for a reason, because we're trying to prevent people from doing the wrong thing, even though most of the people are doing the right thing. And that'll be backed up in the off hours by our police force, actually, in fact. So they are also authorized to levy the same fines as well.
Mr. Mayor, thank you very much. Dr. Richardson, back to you. A question has come in. The province of Ontario recently shared their models and projections for the COVID-19 virus. Do we have projections for Hamilton as well?
So it's difficult to actually have a crystal ball that tells us what's really going to happen. And of course, we'd all like to know that, and we'd like to have that so we know when this is going to be over and when we can get back to things. And we know for a lot of people, things are getting a little long in the tooth, if you will, in terms of being at home, in terms of kids not being in school, in terms of all those things. We don't have precise projections to share with you today. We know from our hospital partners, they shared a lot of information in terms of what they are doing in terms of planning for beds. And what we're all doing is planning for the worst while hoping for the best. Some of the information that tells us that we hope we're along that best strategy is our doubling time, we call it. So that's the amount of time it takes to double in the number of cases. And so we know in countries where things had not been in good control, that doubling time was down to 2 or 3 days. So they would double their numbers every 2 or 3 days. Here in Hamilton, we're sitting at about 5 to 10 days. And so that is good news. We think that really is evidence that the things that people are doing, the things they are doing to stay home, to go out as little as possible, and all of those things are having an impact and are making a difference in terms of what is going on in our community. So we'll continue to look at modeling and see what more we can project as we go forward, but that's the good news for today so far.
Wonderful. Thank you very much for that update, Doctor. Mr. Johnson, we're going to head back over to you. We have received a lot of questions about the parks and open spaces, and then the mayor's even touched on that already too, and some confusion. Are the rules related to the use of some of these areas? Would you mind clarifying, are parks, trails, and open spaces, are they still open? And what circumstances are residents allowed to use them?
So I'm going to start where Dr. Richardson left off, and the first piece is stay at home. So I will talk about parks and what's open, but I'm not doing that to encourage people to travel, as the mayor says, all over the city, exploring parks and enjoying those spaces. We are being asked to stay home and only go outside if it's absolutely necessary, and only take trips if it's absolutely necessary. That said, in the city of Hamilton, all our parks are open. Walk through them, run around in them, let your kid run around in them. We have tons of great neighborhood parks. From my neighborhood days at the city, I remember Bishop's Park in Stinson neighborhood. I grew up on the West Mountain. I remember Olympic Park. Walk through them, run around in them. I live on the Stony Creek Mountain now, Valley Park. I walked the path the other evening, and walking through them is just fine. All of the amenities in parks are closed. Don't play baseball. You can't play tennis, Mr. Mayor. I know that's hurting you. Even the picnic benches and the park benches, not to be used. But in terms of walking, rolling, riding, if those amenities are available in a park, it's absolutely fine to go through. And that's where all of our parks, big and small. We often talk about the big parks, Bayfront Park and Gage Park. So that's why I thought I'd throw in a couple of the neighborhood parks. Because I think the feeling is, well, if I don't go to one of those big parks, how will I get out and enjoy park space? And I will say the one great thing about Hamilton, among many great things about Hamilton, is we have lots of great park space, small and large, across the city. So all the amenities are closed, walk through the parks, but these are parks. And so this question has come up about golf courses. Golf courses are golf courses, parks are parks. Golf courses are closed because they are golf courses. There's a couple of other safety reasons why they're closed. We did notice some people were going out and kids playing in the sand traps because they were dirt areas. Well, they're not maintained and they're not safe to be playing in terms of using them as a sand pit. We do have open water on some of our golf courses, which again are not marked in the same way we would from a safety perspective if it wasn't a park. We also are maintaining our golf courses because our hope is, of course, that they will be able to open at some point, and we quite frankly need the revenue to help out the city's finances. So all of those reasons factor into why they're not considered to be parks, and we haven't designated them as parks, and that's why they're closed. So if you are enjoying our parks and you see lots of people, go somewhere else. Maintain that distance if you can. If it's a little too busy for your own liking, then just go somewhere else. Walk on the sidewalks, walk around your neighborhood, walk the dog near your house. Those are all the good things that we can do. And in Hamilton, lots of the homes that make up Hamilton's landscape do have some amount of space outside. So we're also encouraging people to use their backyards, use their front driveway or front area. And I know that's not for everybody, but in a city like Hamilton, there's lots of space that is inherently there with the homes that we have. And find ways to enjoy the space right around your home, explore your local parks. They're open for you to use from a recreational perspective, but none of the amenities can be used, and they're all signed as such.
Paul, thank you very much. Chief, we're going to head back over to you now. This coming weekend, many residents within our city will be celebrating Easter, Passover, or other faith-based holidays. Can you please pass along what advice you have for those folks for this coming weekend?
Sure, and thanks, Mike. And obviously this weekend, whether it's Passover or Easter, they're both coming up. Obviously Passover today. They're going to look very much different than they normally would. It is a change. And under the provincial state of emergency declaration, which is provincial legislation, events of more than 5 people are prohibited. So this means that private social family gatherings or religious celebrations for Easter, Passover, or other faith-based holidays as they come up can't take place the way they used to. So residents who are organizing or attending gatherings of more than 5 people may be charged under the Emergency Management and Civil Protection Act, and it carries a fine starting at $750. It does include private residences, and this just recently changed. Residents celebrating Easter, Passover, or other faith-based holidays should find alternate, I think Paul Johnson just mentioned them, and creative ways to celebrate, gather, and worship during that time. I do know, for example, in the papers today, they had a virtual service hosted down on James Street, that you can basically watch it on TV. And I mean, that's existed for a number of years in terms of people observing their faith that way. So you can connect with your faith leaders to learn about the options they've come up with for worship services. Could be Zoom, it could be Skype or other online channels. But also spend time with your family from a distance. Host a virtual family brunch or dinner online. And, I realize not everybody has the technology, but where you do, and I certainly know my kids today have all that technology, and in fact, they seem to prefer it to face-to-face contact. So take advantage of that, and if you don't know how, perhaps your kids or some youth will be able to help you how to handle and do that. And think of creative ways to keep your family traditions alive, like a virtual Easter egg hunt for children. So residents who celebrate Easter, Passover, and other holidays in a safe way, so these holidays don't lead to additional cases of COVID-19. I realize it's difficult for people, and Dr. Richardson just got asked a question. I'd love to know when it's going to end too, but it is a change. Perhaps we can make it a memorable one and look at the positive point of view for some way to still achieve the goal. But right now, we can't be together that closely.
Chief, if I may, just one very quick follow-up question in regards to if we do see people congregating in groups of 5 or more, this isn't considered an emergency. They should not be calling 911.
Correct. It's not a 911 emergency. And as with many things, we leave it to the people to perhaps offer the suggestion. If it gets volatile, you don't want to do that. But to the point, bylaws enforcing in the first instance, Monday through Saturday, 7 till 8 p.m. And we're assisting because we had over 110 calls on the weekend between Friday and Saturday, both our own and assisting with bylaw. So we understand it's a process of education, but when we turn 3 or 4 times, then obviously we have to take a different course of action. And there is a requirement for persons to identify themselves under this Emergency Management and Civil Protections Act. So you do, in fact, have to give your name, address, and date of birth.
Chief, thank you very much. Mr. Mayor, we're going to head back over to you. Last week, the city put out a call to the community for donations of personal protective equipment, otherwise known as PPEs. We're all getting used to that acronym now. Can you tell us how the PPE Drive is going? What kind of equipment do we still require? And how people can donate PPE equipment if they have extra?
Thank you, Mike. And yeah, the response has actually been quite terrific. Let me just follow on the last piece. If people are going to complain about gatherings, it's 546 City. They can call, and not 911, but 546 City. Then it'll be followed up and forwarded on to police and our municipal law enforcement. The call out for personal protective equipment has been quite fabulous. A number of people, including Cable 14, made a contribution, and no contribution is too small and none are too big. Nation's Fresh Foods donated 10,000 pieces of protective masks this week. And I know that the Laborers International Union of North America also donated 100,000 PPE material to the healthcare system as well. So the response has been terrific. We could use more, as always. So folks that want to donate, get a hold of us at ppe@hamilton.ca or call 905-546-2424 at extension 2257. And make an appointment, and we'll come back and come by and pick it up. I also want to acknowledge some companies that are retooling themselves to making equipment for the healthcare system and delivering. So CargoJet is one of our major, the major location for CargoJet is in the airport in Hamilton. They are one of 2 carriers that are delivering PPE products across Canada, in fact, picking them up around the world. So thanks to them for their great work. We have Felfab that's retooling their operations to produce protective privacy curtains for our healthcare system and to protect their units. Bionic, the company in Hamilton that's producing face shields for frontline workers. Nico Apparel, making non-treatment related surgical masks for Hamilton Health Sciences as well. And Webbility, which is a custom software for healthcare management company. They have an app that collects community data to identify trends before they hit local hospitals and clinics. So there are many that are stepping up and providing their services or their technology to help us manage this crisis. There's others, Dose Stamps, which is producing protective masks, 3D printing them actually in Hamilton. Leafbox is a portable triage treatment unit provider, and they're working in partnership with Innovate Global and also producing units for the healthcare system. I mean, there's so many that are stepping up and providing services to our community that are going to be helpful. So it's a really a strong rally, and we see that happening around the world. In fact, it's really quite heartening to see everybody turn around and become part of the cause and provide their assistance. But again, for anyone that wants to provide PPEs, personal protective equipment, again, the ppe@hamilton.ca. Get a hold of us and we'll come and get it.
That's great. Great to hear our community coming together. Dr. Richardson, it seems that the country is experiencing some of its worst cases in nursing and long-term care homes. First off, why is that? And secondly, what measures are we taking to address this?
Yeah, these are some of our most vulnerable residents, of course, that are living in long-term care homes. So they generally are people who are either older and so at higher risk in terms of complications from COVID-19, or they have underlying medical conditions, or both of those things, of course. It's requiring them to live in a retirement home or a long-term care home. So these are definitely people we're concerned about. The challenge is that they do live together in closer quarters. They're living in spaces, they often share living areas, they may share dining spaces, they share various things. And then, of course, they also have healthcare providers, care providers that are going in and seeing them and providing quite close care. They're being helped with dressing, they're being helped with washing, all of those sorts of things, with eating. So they're more vulnerable in that way too, in terms of if COVID-19 gets there, the chances that it might spread. So for these facilities, there are measures that have been put in place some time ago now in terms of restricting the number of visitors. So only those who are coming on the most compassionate grounds now are going into long-term care homes or retirement homes. Their staff are screened actively every day to see whether or not they have any symptoms and signs of COVID-19. And they are screening, of course, all the residents as well to see if there are any symptoms that develop. They are taking every measure if an outbreak were to occur to ensure that it spreads as little as possible. And so they're doing things like wearing that personal protective equipment with anybody who's symptomatic. People who are contacts are being asked to stay home or to use masks if they're essential workers. Paul has talked about the challenges with staffing, and so some workers need to go to work just to make sure those residents are cared for, and so we're making sure that actions are taken so they can safely provide care to these residents. We try and do something we call cohorting, so people who are sick, putting them together. We don't have to worry so much if two sick people are together if they both have COVID-19. It's the sick person and the well person that we want to not make sure are mixing. We do things like providing meals on paper plates so that the dishes can just be thrown out. We don't need to worry about those dishes coming back out and being reused. So there is lots of cleaning that goes on. You know, we call them high-touch surfaces, so the things that people touch all the time, doorknobs, surfaces at nursing stations, all of those sorts of things are being cleaned, and even more so in the case of an outbreak. So there is also testing that we can do, and in the case of a long-term care home or a retirement home outbreak, we're testing every person who is symptomatic to see whether or not they have COVID-19 as well. So we make sure that if they have it, they are in that cohorted group and PPE is used. So many things that people are doing to try and decrease the spread. That said, it still is very difficult. We've seen some very tragic situations in the province. As we go forward, Paul talked about a situation we dealt with on the weekend that was quite difficult. I'm very pleased to say, though, that in terms of the increased number of cases that we're seeing in Heritage Green or in Cardinal, at St. Joe's, that the measures that those people are taking, those workers that are in those homes, the operators of those homes, are working so hard, and we are not seeing continued spread at this point. It's only been a couple of days, so I'm hesitant to celebrate too much, but it's good news in terms of the amount of work they're doing and that their efforts are paying off. And for all those families who can only, I can only imagine how concerned they are when their loved one is in a facility that is going through these times. They're not able to go and see them. They are just, our hearts go out to them as it goes through it, and thanks to the long-term care and retirement homes, because they're trying very hard to make sure that they stay in touch with those families too.
By all means. Doctor, thank you very much. Paul, to kind of piggyback on that question answer by the doctor, given the recent challenges at the local retirement homes and long-term care facilities, what advice do you have for families who may be considering bringing their loved ones home during this pandemic?
My advice to them is absolutely have that conversation and do what is best for your family and in particular for your loved one. And I say that not because I don't have faith in our long-term care facilities or retirement homes. I say that because the care and support for family members is something that should be dealt with within that family. So my encouragement is to spend a fair chunk of time, not a couple minutes here and there, but a fair chunk of time understanding the situation wherever your loved one lives, and asking the questions of those who run the facilities that care for your loved one. It is okay to ask questions about what their plans are for pandemics. It's okay to ask, as Dr. Richardson has outlined, do they have all of these steps in place for if there is an outbreak that happens within their facility? It's okay to ask what their plans are if staff become sick and can't come to work. And I think through that conversation that should involve family members, it should involve wherever possible, of course, the loved one themselves, if they're able to be part of that conversation, then you have to make some of those difficult choices. It would be lovely to say it's a yes or no answer, but the reality is that people are in a various state of care in our thousands of retirement home and long-term care facilities. For some in long-term care, their care levels are probably too high for any family to welcome them back home. It would be too much of a challenge. They're not going to be able to go back to the long-term care facility, and so you'll be left with that care for several weeks or even months. So all of those questions will need to be worked through in each family situation, and they're each different. But I would say that if families haven't had that conversation and thought this through, then they should, and engage the environment in which their loved one lives. Satisfy yourself that you are confident that if something happens, they'll be able to deal with it, that your loved one will receive the care that you expect. Because in the middle of a crisis, whether it was this past weekend or whether it's whatever might come our way, you won't be able to get those answers, because that's when everything will be moving along at too fast of a pace. So that's my encouragement, and that's my advice to anyone who's thinking through these issues about their loved ones and with their families. And I think I'll let Dr. Richardson piggyback just a little bit on that. I have those feelings in watching how these places operate, but wondered whether there might just be a couple of words here from Dr. Richardson.
Thanks, Paul. I think you've given very wise advice in terms of families and people who are living in these retirement homes, long-term care homes, if they're able to participate in those conversations, to be thinking it through and thinking about what's realistic. You've heard a lot about the things to be thought about in terms of the care, the degree of care that somebody might need, about what works for your family, about asking the questions of those facilities to see where they're at and how prepared they are, and as Paul said, very much those are questions we all have a right to discuss and talk about, and other things too. Thinking about what is it like in your home. So if you're a home where you know, there's two people going out and doing essential service work, and you're out often, and maybe that's not the best for your loved one to come into that, because there are higher risks in your household of perhaps contracting COVID-19. But if you're a family who's at home all the time, managing to self-isolate or to stay home and follow the rules very, very clearly and closely, you know, that's a situation where there's less risk. And so it might be a really good situation in terms of looking after that individual. So as Paul said, it's very much a personal decision that needs to be made by each family and by each person who's living in those situations to decide which way to go.
Thank you for that. Tough but necessary conversations need to be had. Chief Gert, we're going to come back to you in regards to what are the Hamilton Police doing to ensure businesses and their properties are being protected, especially since we have so many small businesses and restaurants in our city currently shut down.
And thanks, Mike, for the question. And it's a pressing one right now because things have changed in terms of businesses and their vulnerabilities. So first of all, our staffing is foremost, and we've actually managed to redeploy some positions that might have been done for other purposes, divisional youth officers, school liaison officers. Obviously, the schools are closed, so they're out in the street. So we're actually doing more proactive patrols, and I can tell you some of the arrests that have been made recently, because of course life continues, have involved store owners who have been monitoring at a distance through video equipment, give us a phone call. We've had sufficient officers deploy with K-9 quite often as well, and effected arrests at a number of places. So first of all, that's important. The whole crime prevention techniques, which we call CPTED, crime prevention through environmental design, making sure lighting is appropriate, that we can see inside the building, you know, as time passes, and if shrubbery's growing up, you can clip it back. Having, you know, and observing, if something looks suspicious, give us a call, because we will respond to investigate. We know the vulnerability of businesses, but actually one of the benefits is there just aren't that many people on the street as there were before. So that has helped us as well. So we are encouraged for you to call in if you see anything suspicious. We have increased our proactive patrols. Our mounted patrol unit is out. Other units, as I say, who used to do other work are focusing on the vulnerabilities, and we continue arrests in many sectors. We've done a number of drug arrests, firearm seizures, the full gamut. It's not just the one aspect we'll focus on. So we continue focused on the multiplicity of things that we have to do in our regular daily work. And strangely enough, traffic enforcement continues. People continue to speed. I don't know if that's because there's less cars on the road. The laws still apply. So we're continuing on with enforcement as well for that, whether it's impaired driving, traffic issues, vulnerabilities for businesses, and the whole other gamut. So our people are engaged. We do have a few more officers in terms of frontline position. We'll have to see what happens through the course of time on that.
And of course, please still stop at stop signs.
Definitely.
Yes, thank you. Mr. Mayor, we're going to head back over to you. Can you speak to us a little bit about what the city is doing to support small businesses within our city and start to think about economic recovery?
Thanks, Mike. Very good question, and certainly it's top of mind for the Chambers of Commerce and our own Economic Development Department. They've set up the hometownhub.ca. Visit that site. It'll direct you to places and businesses that are still working online, so you can continue to support them. The Hamilton Business Center right here in this building is still functioning, so go to at hamiltonbizcenter.ca for small business support. And I know that you know, people are either still worried about their business or wondering how they're going to get through, or wondering, you know, what can they do to maintain their business. They can get some advice from our Hamilton Business Center as well. And you can visit the various local business improvement area websites. Many of them are running contests or special offers for online services or pickup services or delivery options. So there's much that you can do to kind of connect with businesses that are still functioning and operating out there, and they certainly could use your support. I would say, you know, going forward, there's still much more work to do in terms of economic stimulus for the country, and I think a lot of those resources will be coming from our federal partners. And you know, $130 billion is already you know, being pushed out the door. Access to that is open right now, and hopefully people will get their their portion of the assistance that's out there for them individually, and that certainly for some businesses will help. Today, the federal government announced that they will also provide 100% of the cost for anyone that is planning or would normally have planned to hire students this summer, which would include municipalities, but maybe a lot of other companies would normally have hired students as well. So the government of Canada is going to pay 100% of that cost. So that supports not only local businesses, but local employment for the municipality as well. And I know that we were looking at potentially laying off a number of folks. We may not do that as a result of that recovery if we're eligible for that. I'm not sure about that yet. So there's a lot of resources coming our way, but economic stimulus will have to occur. Once we get past this crisis. I know that the discussions with our federal and provincial partners are actively looking at not only help and support for municipalities that are likely going to be running a deficit this year, but also economic stimulus to get people back to work. So you can anticipate that those conversations are happening as we speak with our federal and provincial partners, and that will continue. And I know that they'll be prepared to do something in the economic stimulus way once we get past this virus period.
Mr. Mayor, thank you very much. Dr. Richardson, we're going to come back to you in regards to, we've been hearing a lot about worst case scenarios in the media. What is public health doing to prepare for that worst case scenario?
So for us, in terms of our own work and our own staff, we have about 60% of our staff working on this right now on COVID-19. And that's just keeping up with the day-to-day work in terms of following up cases, answering questions that people have, inspecting facilities to make sure that they're doing the things they need to do, working with retirement homes and long-term care homes in terms of infection control and answering questions. It's just, there's so much that is going on. We're also training up additional staff to have them ready. We think that these measures, the infection control measures, the case and contact tracing, are going to continue to be a backbone of what is needed as we go forward through this, and as we try to make some decisions about where do we go from here in terms of how we manage the whole COVID-19 situation. The important work that's also happening, though, is across the healthcare system as a whole, not just in public health, and that includes our hospitals who, as we've talked about, have been working very hard to make sure they have enough ICU space, to make sure they have enough acute care bed space in order to look after people who might need to be in the hospital and be in those intensive care beds. But it's also really important as well in terms of our community care providers. So our primary care doctors in terms of how, and nurse practitioners and other providers in terms of how they can help people to be cared for at home and try and keep them out of hospital. Our mental health providers and the supports that they're needing to continue to give as we go through all of this and some of the increased distress that we are seeing as this continues on. Our first responders, of course, are hard at work in terms of the work that they are doing to support us. You've heard a lot from the Chief Gert tonight, but also from our paramedic chief, and they're looking at new and different ways that they can help serve. So, one of the realities is when we go through tough times is that we need to be very innovative in terms of our approaches that we take and learn some lessons really quickly. And the good news is we're seeing that across the system in terms of what more can we do, how could we do better, how else could we reduce the impacts of this disease, and just kudos out to all of those that are looking at innovation and how we could do things even better.
Very much so. We have time for one last question before we'll throw it back to the mayor to kind of wrap up his final thoughts. So Paul, it will go to you. You got a couple minutes here. We've had a number of questions about whether or not the city will be making changes to streets and sidewalks to allow pedestrians more space to walk and keep their physical distance. You got a couple minutes here.
Sure. So it certainly was an idea that came to our Emergency Operations Center. As we examined it, we didn't see a tremendous reason to do it in terms of it bringing some heightened degree of safety from a physical distancing perspective. And going back to what Dr. Richardson has been saying and the mayor as well, people are doing a pretty good job. They're not going to work when they don't have to, and they're not out when they don't need to. So we don't have these really, really busy, crowded streets, which may allow for it. And to be honest, the public works effort, the effort in realigning our transit and looking at the impacts for emergency services on major routes would be a huge effort that we don't have time to do. And on some of the minor streets, there really isn't a reason for it. And I'll go back also to the fact that, you know, when you are passing somebody or walking by somebody on the sidewalk, and I think Dr. Harvey at one stage answered this, if that 6-foot halo kind of gets constricted a little bit as you're passing somebody, there's very low risk in that movement. So I think we can share the sidewalk well. We're seeing that, and if we ever felt that we got to a stage where we're sort of Toronto level street traffic, we might have to think about that, but right now people are doing the right thing. They're staying home. It's a great message.
Good stuff, Paul. Thank you very much. And to everyone who's been watching on Cable 14 and the city's YouTube channel, and of course listening on CHML, we appreciate it. Before we wrap up, Mr. Mayor, I'd like to pass it off to you for any final thoughts.
Just want to remind everyone out there that there's lots of help and support available for you. I just got some compliments today about how easy our website is to navigate. So go to the hamilton.ca/coronavirus website. All of the information in terms of help and supports, whether it's mental health or Kids Helpline, or whether it's financial supports that are being delivered by the federal or provincial governments, are on the website. So you can go to one source, get all the information you need, and make all the connections that you need. And just finish off with, you know, again, thanking everyone out there for the very good work that you're doing, you know, adhering to this very unusual and very unique situation. And you know what, we know why we're doing it. And I think most people are understanding the message. And we're getting a very little pushback from the community at large. And that is a credit to not only the good staff that have set up the scenarios and the good information coming from our public health as to why, and understanding that all of our services are being maintained and safety and security is still in place. But we know it's exceptionally difficult for a lot of people in our community. We're going to do everything possible to help everyone get through this. We also encourage friends and neighbors to help one another in the best way that you can. Some might have more resources than others, and help people through. Help them now, it'll pay off later. And do take advantage of all the resources that are out there for you for assistance. So thank you. Happy Passover for our Jewish community, and for those that are looking forward to Friday and a hike, don't do it this year. Take a rain check. You can go on a hike some other time. This is not the time to kind of back off of our physical distancing. This is a time to maintain that position. And if we do that, we will get through this together and come out of this, I think, a stronger and more knowledgeable community that is ready for any next event that might happen.
Thank you very much, Mr. Mayor. And of course, as we all know, the Easter Bunny is an essential service, so he will be out this weekend. As we get to the close of tonight's program, we want to remind you once again that the city is accepting donations of personal protective equipment to provide much-needed resources for the citywide response to COVID-19. The equipment will be provided to frontline workers, emergency responders, and other health professionals. The types of equipment that will be accepted include surgical masks and N95 masks, impervious gowns, gloves, face shields, swabs, and hand sanitizer. The city is requesting these items from local healthcare providers, pest control, hospitality providers, nail salons, and construction companies. Homemade equipment will not be accepted. To donate, email ppe@hamilton.ca or call 905-546-2424, extension 2257 for more information. We want to thank our panel. We want to thank our American Sign Language translators, and of course our production team for making tonight's town hall possible. We will continue to broadcast these live virtual town hall meetings each Wednesday evening at 7 p.m. right here on Cable 14, the City of Hamilton YouTube channel, and of course on 900 CHML. Thank you very much, everyone. Have a good night.